Coconut water was once used as an intravenous fluid. Usage and precautions. Dear friends, coconut water is a popular drink, especially in the summer. It is rich in carbohydrates and electrolytes such as potassium, sodium, and magnesium. Because of these components, many people believe that coconut water can help treat or prevent dehydration. But how accurate is this belief? What are the real benefits of coconut water? And what should we keep in mind when consuming it? The coconut tree works like a natural water purifier. Rainwater seeps into the soil, mixing with minerals and trace elements. The tree's long roots absorb this water and transport it upward through xylem vessels, which function like the tree's blood vessels. Along the way, more nutrients are added through the phloem. When the tree forms a young coconut, a small chamber develops inside, carefully protected by fibers and a hard shell. Into this chamber, the tree deposits purified water, which becomes coconut water, clear, sterile, and naturally rich in electrolytes. In fact, it is like the amniotic fluid that nourishes the coconut flesh. As the fruit matures, part of this water gradually transforms into the white coconut meat. To produce just 1 liter of coconut water, the tree must filter many liters of groundwater. Composition of coconut water. Coconut water is a clear, naturally sweet liquid found inside coconuts. As the coconut matures, the water is gradually replaced by coconut flesh and air. In young coconuts, the flesh is still thin, soft, and translucent, leaving more liquid inside. Coconut water is a popular drink in tropical regions, especially Southeast Asia, the Pacific Islands, and the Caribbean. It is a natural beverage that contains no fat, is low in calories, and is rich in minerals. Young coconut water can serve as an electrolyte solution in cases of dehydration. In certain circumstances, it has even been used as an intravenous fluid substitute when medical saline solutions were unavailable. Main components of coconut water: water, 95.5%, nitrogen, 0.05%, phosphoric acid, 0.56%, potassium, 0.25%, calcium oxide, magnesium oxide, iron vitamins, B1, B2, B3, B5, B6, and C. Coconut water as an intravenous fluid. In special situations, particularly during wartime, coconut water was used as a temporary IV fluid because its electrolyte composition and osmotic pressure are similar to human plasma. The coconuts selected for this purpose had to meet strict criteria: not too old, not too young, containing soft flesh, and clear water that was low in oil and acidity, and free from impurities. They were also sourced from trees grown in clean, open environments, far from livestock, waste, or pollution. The selection was usually carried out by physicians or experienced locals before the coconuts were used for transfusion. Medical use of coconut water. In the past, when coconut water was used for intravenous infusion, a sterile needle was inserted into the soft area near the stem of the coconut to draw the liquid directly into a container without breaking the shell into pieces. Afterward, the coconut was split open for inspection. If the flesh appeared uneven, thick in some areas, thin in others, or if the water looked cloudy, it was discarded. Today, however, With advances in modern medicine, using coconut water for IV therapy is no longer recommended. Instead, sterilized and clinically tested medical solutions are used. Benefits of coconut water. Skin health and beauty. Contains cytokinins that may help improve skin, reduce oiliness, and promote a clearer complexion. Energy and immunity boost. Provides essential nutrients, potassium, and vitamin C to support immunity and overall vitality. Relief in common conditions. May help with dehydration caused by fever, diarrhea, or excessive sweating. Potassium helps the body retain fluids, while vitamin C supports faster recovery. Blood pressure support. Some studies suggest coconut water may lower high blood pressure. Coconut water and dehydration diarrhea may help rehydrate children with mild diarrhea, but there is no strong evidence that it is more effective than oral. Rehydration solutions. Exercise. Some athletes use coconut water after workouts. It does rehydrate, but not more effectively than plain water or sports drinks. Fever. Drinking coconut water may help replenish fluids and electrolytes lost during fever. Precautions. Coconut water cannot replace plain drinking water. Consuming it daily as the main hydration source may cause electrolyte imbalance and affect muscle function. A varied diet with different fruits is recommended. If drinking one coconut daily, other fruits should be reduced to avoid excess sugar and calories. Young coconut water is better than mature coconut water because it contains less sugar, is safer for blood sugar control, and does not contribute to weight gain. For adults, coconut water should be treated as a refreshing beverage, not a substitute for regular water. How much coconut water should you drink daily? It is best not to drink more than 1 to 2 coconuts per day. Who should limit coconut water? People with low blood pressure, those who have just undergone surgery, or individuals with health conditions such as kidney disease or hyperkalemia should consult a nutritionist before drinking coconut water. In Western countries, coconut water is often recommended for children and breastfeeding mothers as it contains monolaurin, a compound that helps strengthen the immune system and protect against colds, flu, and infections. For children, coconut water offers several benefits. Low in calories, cholesterol-free, rich in potassium and fiber, helps reduce constipation, aids digestion, and replenishes lost salts during diarrhea. However, infants under 6 months, only under a doctor's advice, since breast milk remains the most essential nutrition source. Older children, start with about 50 mg for a few days to check for allergic reactions. If safe, it can be added gradually, but should not be given daily. A varied diet is still essential for proper growth. How to consume coconut meat, flesh. Unlike coconut water, coconut flesh is very high in energy. About 100 grams of coconut meat provides 354 kcal, mostly from fats and carbohydrates. Although high in saturated fat, it can increase good cholesterol, HDL, and lower bad cholesterol, LDL. In addition to vitamins and minerals found in coconut water, coconut meat also provides vitamin E, vitamin K, and selenium. However, it should not be eaten daily. Excess consumption may lead to weight gain, obesity, and metabolic disorders. Eating too much can also cause bloating and digestive discomfort. It is best to consume only 1 to 2 times per week. People who should limit coconut meat include those with weakness or poor digestion, pregnant women, people with diabetes, high cholesterol, obesity, patients with atherosclerosis or heart disease.